I call the member for Kooyong.
Thank you, Madam Deputy Speaker. I rise today to speak on the bills before this House. The Fairer Private Health Insurance Incentives Bill 2011, the Fairer Private Health Insurance Incentives Medicare Levy Surcharge Bill 2011, and the Fairer Private Health Insurance Incentives Medicare Levy Surcharge Fringe Benefits Bill 2011. Madam Deputy Speaker, the government's proposed changes, which will means test the private health insurance rebate, is a retrograde step that is vehemently opposed by the Coalition. Means testing the rebate will drive up premiums, force millions of Australians to downgrade their private health care, with many abandoning it altogether, and increase the pressure on an already stretched public health system. What is more, it is a fundamental breach of another Labor promise. From Kevin Rudd to Julia Gillard to Labor's last Minister for Health, Nicola Roxon, the government repeatedly stated its commitment to maintain the private health insurance rebate in its current form. In September 2007, Nicola Roxon said, and I quote, "On many occasions, for many months, Federal Labor has made it crystal clear that we are committed to retaining all of the existing private health insurance rebates. The Liberals continue to try to scare people into thinking Labor will take away the rebates. This is absolutely untrue." Then again in February 2009, Nicola Roxon said, "The government is firmly committed to retaining the existing private health insurance rebates." Madam Deputy Speaker, we now know the truth. Whatever modicum of trust was left after Labor's successive backflips on the carbon tax, offshore processing and mandatory pre-commitment for pokies, it must have surely evaporated after this latest government reversal. How can Labor be trusted on anything? In contrast, the Coalition has been consistent in our commitment to not means testing the private health insurance rebate. It goes right to the heart of an individual's freedom to choose, and for what many consider to be an act of personal responsibility. We, as Liberals, want a robust private health system, just as we do in education. And we want this private system sitting side by side with a viable and an effective public system. Madam Deputy Speaker, this was well put by Margaret Thatcher when she, as Prime Minister, said of private health insurance in the United Kingdom, and I quote, "I, along with something like 5 million other people, insure to enable me to go to hospital on the day I want, at the time I want, and with the doctor I want. For me, that is absolutely vital. Like most people, I pay my dues to the National Health Service. I do not add to the queue. And if I said, look, because I cannot come when you want me, I must come when I want to, you would accuse me of jumping the queue. I exercise my right as a free citizen to spend my own money in my own way, so that I can go on the day, at the time, with the doctor I choose and get out fast." Madam Deputy Speaker, that was Margaret Thatcher, and this thinking could equally apply to the Liberals' approach to private health insurance in this country. There you have it, the doyen of British conservatism, whose record in limiting the excesses of the state are revered the world over, explaining why she and 5 million of her fellow Britons have private health insurance. So wouldn't Margaret Thatcher be surprised to learn that in Australia, where our public system is even more effective than that of the UK or the United States, that we in Australia have around 12 million Australians with private health insurance. A remarkable 52.9% of the population. And in electorates like mine in Kooyong, the number is even higher, with 74.5% of people in Kooyong having private health insurance. And this includes nearly 25,000 people who are singles. In Kooyong, this means that more than 100,000 residents in my electorate are covered by private health insurance. These changes will take money out of the pockets of people in Balwyn and in Hawthorn, in Kew and in Camberwell, and in Deepdean and in Canterbury. Less money for them to meet the rising costs of living, because this money will have to now go, if they choose, to keep their private health insurance. Madam Deputy Speaker, significantly, my colleague and friend, the member for Dixon and Shadow Minister for Health, said in a very valuable contribution in this House last week that a remarkable 5.6 million people with private health insurance have an annual household income less than $50,000, and 3.4 million Australians with private health insurance have an annual household income of less than $35,000. Never let it be said that this is a rebate for the rich. These are aspirational Australians, some who do it very tough, but take out private health insurance because they have made a considered choice. This is how they want to spend their money. This is the epitome of personal freedom. So too, Madam Deputy Speaker, when it comes to the private health insurers themselves in Australia, a number of them are not-for-profit organisations whose bottom line is to not to expand their margins, but to achieve more affordable health care that delivers a better service for the consumer. We should also not forget in this House that it is private hospitals that do much of the heavy lifting in our healthcare system. They look after 40% of all patients in Australia. And in 2009-10, this equated to 3.5 million patients. And for elective surgery, these numbers are even higher, with nearly 2 in every 3 cases taking place in private hospitals. Madam Deputy Speaker, these are remarkable numbers and reflect the fact that people, Australians, have been voting with their feet for private health insurance. Indeed, it was the Howard government's policies which facilitated this very high take-up that we now enjoy. In 1997, John Howard introduced a 1% Medicare levy surcharge on taxable income, penalising those income earners who didn't take up private health insurance. 1999 saw the introduction of the 30% rebate. The year 2000 saw lifetime health cover, and from 2005 the more elderly people in our community received greater rebates for taking up private health insurance. At every step of this reform process undertaken by the Howard government, you could see that the rates of take-up dramatically improved. For example, in the 12 months after the introduction of the 30% rebate in January 1999, the percentage of Australians with private health hospital cover jumped from 30.6% to 43%. And in the years after have jumped to the level we now enjoy at around 52.9%. What is so concerning, Madam Deputy Speaker, to members on this side of the House is the large number of people that will be negatively and directly impacted by this government's legislation. Around 2.4 million people will see immediate rises in their premiums of 14%, 29%, 43%, depending on their income levels. And according to the Australian Health Insurance Association, over 800,000 more Australians will be admitted to public hospitals. In their analysis, the top-tier consultancy Deloitte has said that 175,000 Australians will withdraw their private health cover in the first year, and 583,000 Australians will downgrade their cover. Over a 5-year period, those numbers will dramatically rise to 1.6 million people that will withdraw their private cover and 4.3 million people that will downgrade their cover. Even the state-owned Medibank Private has come out publicly and stated that 37,000 of its members will remove their private cover and 92,500 of their members will downgrade their cover. Madam Deputy Speaker, I have no doubt that the government's decision to means test public health insurance will be deeply unpopular with the Australian people. The public understands this is not about the future costs of the program, for the rebate as a proportion of the total healthcare spend, public and private, has stayed constant at 3.5% for the last decade.
Order.
The public understand this is not about improving the state of our healthcare system and our public healthcare system, for they have heard that all before. The hospital fix that Kevin Rudd promised but never arrived, and the super clinics that were promised but were never built. But what the Australian public do know is that this government is under enormous budgetary stress as a result of their own fiscal mismanagement. This is just a mad dash for cash. They need to scramble for a surplus, and in doing so will hit Australian families once again. The problem, Madam Deputy Speaker, that is in doing so the consequences of these changes will be profound. Healthy and young people that will make up thousands of the thousands of people who give up their private health cover will therefore reduce the cross-subsidy that is a hallmark of insurance schemes. Premiums will rise, membership will fall, and the overall pressure on our public health system will even become more pronounced. Madam Deputy Speaker, be under no illusions. This is bad policy from a bad government, and it will come at a bad time for Australian families. This legislation before the House to put a means test on private health insurance in this country must be opposed by all clear-thinking members who are interested not just in the good health of our country's balance sheet, but are interested in the physical health and the well-being of all Australians. Thank you.